Perfect. So as Martin mentioned, the title of today's webinar is How High-Frequency Ultrasound Imaging is Supporting the Preclinical Researcher in Their Various Applications. I will do an overview of high-frequency ultrasound and how it works, and then we'll spend a bunch of time looking at the Prospect T1 system as well as some main applications. And my hope is that we'll spend at least the latter half, if not more, taking a look at specific images so that you can begin to understand how this type of imaging can be integrated into the work that you're doing within your labs already. So for those of you less familiar with ultrasound, I really just want to spend a couple of minutes on the different imaging modes so that we all understand when I say something like B mode and M mode and Doppler, what I'm talking about and how ultrasound works. So ultrasound is a non-invasive imaging technique, and it does not require ionizing radiation, which is what makes it ideal for long-term studies in the preclinical world. Instead, it's going to use sound waves. So the transducer that you see here, so again, this is not the Prospect T1 system, this is just a general review of how ultrasound itself works. The transducer is both going to send the sound waves and detect those which are reflected off of the object that we're imaging. And in different imaging modes, this is going to behave a little bit differently. And so basically, as some of us are familiar from the world of pregnancy and in the clinical world, the transducer is often placed onto the skin with some ultrasound gel, and whatever appears below the transducer is what we're going to see appear on the image. And the probe is simply moved over top of the skin to look and identify for the different anatomical targets. The same applies to the preclinical world. The hair is removed from the animal, the probe is placed on the skin in contact with the ultrasound gel to allow the sound waves to be transmitted, and we get an image of the anatomy below. So when we talk about small animal imaging or preclinical imaging for small animals, we often are talking about high-frequency ultrasound. And why is that important? Well, if we compare the difference between the size of anatomical targets in a human, for example, compared to a mouse or a rat, these are much smaller anatomical targets. And so how we're able to resolve these small anatomical targets is using higher frequency sound. But there must be consequences there, or why wouldn't we use high frequency sound in the human world on a much larger scale? And so when we talk about the sound waves, high frequency means a shorter wavelength. And the consequence there is that it can't penetrate as deep into the tissue. So we're going to have depth of penetration that we need to keep in mind, but much better resolution. So within our anatomical target, if we have these 3 dots as examples of what we're looking for, with high frequency sound, we're going to be able to see that there are in fact 2 separate entities that we're able to image. However, we may only be able to see the ones on the top and not deeper. And that's because, again, we're using high frequency sound that may not penetrate quite as deep. When we go into the clinical world, often we're using lower frequency sound. And in this case, we have a longer wavelength, which allows for longer penetration or deeper penetration into the tissue. However, it suffers from poor resolution. So again, if we have the same 3 dots and we're using low frequency sound, we can't resolve that there's 3 individual dots, but we can in fact see all 3 because we have that increased depth of penetration. So to understand kind of how this works, if we think of the rat carotid artery as an example, if you've done the surgery on this vessel, you know how incredibly small it is. When working at high frequency sound, this for example being 40 megahertz, that gives us 30 micron resolution, we're able actually to see the common carotid artery as it bifurcates to the internal and the external vessels. And so you can imagine how small these structures are. Your scale on the right-hand side is in millimeters, and we're able to resolve and see these very clearly. And when our field of view is zoomed in on the wall of the vessel, we're actually able to measure the intima media thickness as well. So this is where high frequency comes into play with small animals because of the small anatomical targets that we're looking at. So let's move now to acquisition modes. So the first one that everyone talks about and everyone generally starts with is B mode or brightness mode. And this is simply a 2-dimensional grayscale image, which is going to represent the anatomical structures. We can acquire either a single still image, as we see here on the abdomen, or a movie or a cine loop of images, so where we want to be able to study how a structure is moving, such as the heart. Things to note with ultrasound, the sound waves don't penetrate through air or bone, and so we have to find a window basically within the thoracic cavity to be able to see the heart. And so on some of the images, you may begin to see artifacts where you have something very bright and then a dark shadow below. Those are going to be things like the rib and the sternum that we try to work around as we acquire the pictures. The ultrasound gel is required to transmit the sound both into and out of the tissue. As a coupling to the transducer. And so when the sound is emitted, it's going to travel into the tissue through the gel, and then the transducer is going to wait to listen for that reflection coming back. And how long it takes to come back is going to tell the transducer how deep the structures that we're imaging, and then in the background, the electronics are basically going to generate this image for us. In B-mode imaging, and this will come into play when we talk later about Doppler imaging, we're both sending and receiving the same frequency of sound. And so this is important because it allows us to know that we're imaging structures which are remaining in the same location. Of course, the heart is beating, so it is moving, but it's not moving like blood in and out of the plane that we'd be imaging on. When we move to M mode or motion mode, we're simply taking our B mode image and looking along a single line to see how that structure is moving over time. And so we have our scout window up top where we can see that parasternal long axis of the left ventricle that we saw previously as it beats. And we're going to look just along this one line that you see here in green, and we're going to see how it moves over time. And so along this line, we can see the heart moving through diastole into systole, again out to diastole, and this becomes a very high frame rate or high sample rate image that's taken to allow us to fully characterize the cardiac function within an animal. Both B mode and M mode can be done and are traditionally done for cardiac imaging in either the long axis, as you see here, so the full left ventricle is shown with the apex down here, and the aortic outflow or the aortic valve in view. When we go to the short axis view, we're simply going to rotate the probe 90 degrees and we're going to see a circle as it moves and contracts, and we'll see that a little bit later on in the presentation. Now moving on from grayscale images to Doppler modes. So Doppler is used to detect moving structures such as blood or tissue. And specifically here, let's start talking about blood. And so in this example, we're taking a look and we want to know information about the velocity of the blood flow as well as the direction. And this is determined by measuring the Doppler shift. So what do I mean by the Doppler shift? Like with B mode, we're going to transmit a certain frequency of sound. If the blood is moving towards the transducer at some angle, and we'll talk about that in a second, then the frequency of sound which is reflected back is actually going to be of a shorter wavelength, and that's going to be considered the Doppler shift, the difference between what's transmitted and what's received. Likewise, if we're transmitting sound and it's hitting something that's moving away, like a red blood cell, and then our frequency of sound is going to be lower. And so again, that's going to be a Doppler shift. And the system is specifically looking for sound waves that are coming back that are not the same as what's being transmitted. And that's going to allow the system to know and understand that we're looking at a reflector which is moving, typically red blood cells within the blood. When we're doing this, we need to consider the angle. And by angle, I mean the angle of the transducer or the sound wave being sent with respect to the blood flowing through the blood vessel. And so that's theta here. And basically, we want the transducer as in line with blood flow as possible to be able to know that we're getting an accurate assessment of the velocity, because there's a mathematical calculation between the Doppler shift that we see coming back, calculating the velocity of the blood flow. And that equation takes into account theta. The smaller theta, the more accurate and reproducible this data can be. So there's lots of different Doppler modes. One of those being color Doppler that we're seeing here. And basically in color Doppler, we're going to be able to get some information on directionality as well as velocity in a color overlay on top of a B mode image. So this is actually the ascending aorta as it comes out of the heart. As it takes a turn, goes through the aortic arch, and we can see the three branches being the innominate artery, left common carotid artery, and left subclavian artery coming off. And with color Doppler, we get an indication of directionality based on this scale. So anything that's red to yellow is going to be going towards the transducer, and anything that's blue to white is going to be going away from the transducer. So anatomically, this makes perfect sense. An acronym that most sonographers use to remember this is BART, blue away, red towards. Where you're seeing this little blue speck in the middle here, it's not in fact a reversal of flow. It's simply called aliasing, which means this scale has been maxed out and we've started to wrap around. So this would actually be the ideal place to measure the velocity of flow through the ascending aorta because it's where it's going to be the fastest and most laminar flow. We can use these then, like take a look at the flow through the heart, and we'll look a little bit more detail into this, but basically on this scout window that we saw previously, we're going to have a color Doppler image. That's the last one as we switched into pulse wave Doppler. And we're going to place a sample volume within the jet that we're looking for. And here we're specifically looking at the jet coming through the mitral valve. So going from the left atrium into the left ventricle. And this is a very characteristic waveform of that flow velocity. And we'll talk more about this when we look at specific images of cardiovascular function. But for those of you who do this work routinely in your lab, you'll recognize this right away with the full measurement package to assess diastolic function. Talking about contrast agents. So Doppler modes are used to look at larger blood vessels where we're measuring flow velocity and laminar flow in those areas. When we want to get down to the microvasculature, we actually have to use a contrast agent because we aren't able to resolve the structures of the capillary beds and things like that within tumors and other organs. And so to be able to do this, the contrast agent used for ultrasound is called a microbubble. And basically there's a shell of some sort, typically a lipid shell, albumin shell. There's lots of different chemistries used to make these shells. And inside there's going to be air or gas. It's a specific biocompatible gas so that as these microbubbles begin to degrade, there's no negative effect on the animal that they were injected into. And so there's two different types of microbubbles. One is non-targeted. So that's just going to be a microbubble that's injected IV, designed to stay within the vasculature, and it will simply flow through. Other microbubbles may have a target on the outside, like an antibody or a ligand of some sort that's designed to bind to specific cell markers on endothelial cells. These microbubbles are too large to go between the cells typically. And so we're looking at targets that are accessible to the blood or on the endothelial cells on the inside of the blood vessel. Things like VEGFR2, so vascular endothelial growth factor 2, important in cancer imaging. Detecting the level of expression of that cell marker can be done as well. With this Prospect T1 system, there are two ways to look at the contrast signal. One that you're seeing here on the right is it's called reference subtracted, where you're taking an image before any contrast was injected and you're subtracting it from the image or the cine loop in which that contrast agent was injected. The difference is going to be colored green, and you're therefore able to see the green overlay on this image. Another way to visualize the contrast agent, which is a little bit more specific to the contrast agent itself, is called harmonic imaging. And so if we take a look again at the sound wave, which is transmitted from the transducer, it hits the microbubbles, and the same frequency of sound will be reflected. And so that's how we're going to do the reference subtracted image. It's actually a B mode based image analysis. However, when the bubbles begin to oscillate, they're also going to send back a harmonic of that sound frequency. So basically double the frequency of the sound. So if we transmit at 20 megahertz, for example, then we're going to get 20 megahertz back, which is what's used for reference subtraction, but we're also going to get 40 megahertz back. And if we listen only for the 40 megahertz signal, then we're listening specifically for the contrast agent signal to come back. Okay, so this is a technique which is available on the Prospect T1 using the 20 megahertz probe. I'll show another example of this later on as well. So a little bit more about the Prospect T1 system specifically. We'll take a look at the components and the standard configurations and a few of the add-ons which are available. So as Martin mentioned in the introduction, the Prospect T1 is the first tablet-based high-frequency ultrasound system. And so this is all that the system is composed of. So this is a 15-inch tablet if you'd like. It is slightly thick here, so it's about an inch or two thick, and that contains all of the electronics necessary to run the ultrasound system. The probe, as you see here, is actually connected directly into this tablet. And then we have our animal handling system here. and the probe which is attached to it. And so with some adjustments on here, you can get the probe really into any position to be able to acquire the images that you'd like. The platform moves forwards, backwards, left and right, and actually rotates on this platform as well, and can go up and down to have the different anatomy come into focus within the ultrasound image. The tablet helps to greatly reduce the footprint and the required area that the system is takes up within your lab, and it also makes it very simple to move when necessary. So simply taking the tablet and the animal platform and placing it onto a cart and moving it to whatever location you need it to go to within your facility or within your lab. The software is quite intuitive to use, and it does have a touch screen, which works with gloves on, so you can keep your gloves on and walk your way through the software and begin to acquire images quite quickly and save them as well, of course. There are multiple data formats which can be saved. So there's raw data, which can allow the more advanced physics-based people to do some different analysis on the images and the data that's being acquired. Cine loops can always be saved, so you can go back and export specific images or do the measurements offline from there. And then, as I mentioned, still images can be exported. AVI movie files can be exported, and there's DICOM compatible versions for the data export as well. And of course, we can do the offline analysis in software back at our computer desk, so we're reserving time on the system for acquisition of images and not data analysis afterwards. When you're still in the animal facility, you may want to be back at your desk or at home working on your own computer to do that. There are two different probes with this system. Both are single element probes. One is 20 megahertz, and it's actually user selectable between 15 and 30 megahertz. This is primarily used for rat imaging, as well as harmonic contrast imaging. The 40 megahertz probe, a higher frequency sound, better resolution, is user selectable between 30 and 50 megahertz. This is typically used for mouse imaging, but can also be used for superficial anatomical targets. The main difference between the two, as we talked about before, is the depth of penetration. So you really select the probe that's most appropriate for the anatomical target that you're looking at. The platform itself is quite compact, as you can see here. It is designed for ergonomical positioning of the probe. So there's different levers that are released to allow you to rotate the probe really on any angle to be able to get the images that you require. There's a platform that does physiological monitoring, both for mice and for rats. They have integrated heating as well as respiratory and ECG monitoring. And as I mentioned, you can switch between the mouse and the rat one very simply by just simply lifting the one that you don't require off and placing the other one on. With the knobs that you see here on the side, we can move the platform in the X, Y, and Z directions quite easily. This knob here is to move it up and down, and these two move it left and right and forwards and backwards. It can also move across this tract here as well to position the anatomy of interest underneath the probe, so you can acquire your pictures. Standard system configurations, they come with all imaging modes already available. So B mode, M mode, all of the Doppler modes, the different contrast modes are available, all of the measurement tools are there. And if we go with the mouse configuration, of course, you're going to get the mouse bed and the mouse probe. For the rat configuration, the only difference is the rat bed and the rat probe. And of course, those can be added back and forth depending on your research needs without any issue. There are a few things which are add-ons for this system. And so we'll take a second to talk about those different add-ons. One being a 3D motor. So for people doing cardiovascular imaging, they're not really going to use a 3D motor, but someone doing cancer imaging, their main goal may be to measure tumor volume. And so the 3D motor mounts onto the side of the animal scanning platform here. You can see it located here as well. And that's simply going to translate the stage underneath the probe given across a specific distance with a specific step size that you would then specify, and includes the software to do all of the visualization and analysis that's necessary on these images. Another addition that can be added to the system is image-guided injections. And so in this case, you may want to do an image-guided injection into the myocardium, for example, to inject stem cells into the border zone of an infarct to help heal that animal, or you may want to do an image-guided injections with a pulled glass capillary into a developing embryo, for example. And we'll take a look at this a little bit more in future slides. But basically, the image-guided injection mount is going to mount directly onto the probe. And what this is going to do is make it much simpler to align the needle with the imaging plane to allow you to do these injections and position the animal in the anatomy of interest as you like and as you need to when you're doing these injections. Another add-on is shear wave elastography. So this is a bit more of an advanced technique for ultrasound users. And here we're looking at the mechanical and elastic properties of tissue. For example, in the liver, you may want to look for liver fibrosis. And when fibrosis is present, the elastic properties and mechanical properties of the liver are going to change. And what we do here is we use a secondary push probe that again is mounted onto the imaging probe. And we're going to have a separate controller which will send a pulse through the push probe. And basically that pulse is going to propagate across the anatomy of interest, the liver, for example. And we're going to see how fast that wave goes across the image. In tissues that are developing disease like fibrosis, which may be a more homogeneous change within the liver, we're going to see a global change across the liver parenchyma. If you have, for example, a lesion or a tumor starting to develop, it'll be much more of a focal lesion that we're able to identify. The system is able to acquire all of this data, create an elastogram that's overlaid again on top of the B-mode image, and analysis can be done by drawing various regions of interest across the anatomical structure and providing you with a numerical quantification of the velocity of that push wave going across the tissue. And the last add-on is for sonoporation. So we talked about microbubbles initially when talking about imaging the vasculature, and we hit the bubbles with a specific sound wave and they reflect the sound back. That's what we do for imaging. However, sonoporation is actually the controlled cavitation of the bubbles or bursting of the microbubbles. And this is done in a very controlled way with a specific amount of power. And the goal here is to increase the permeability of the surrounding cell membrane or to open up the blood-brain barrier. So here we're not looking to image microvasculature, we're looking to open something up, the cell membrane again, or the blood-brain barrier. The purpose here being to increase the delivery of a payload, and that payload may be included in the contrast agent to a specific area, whether that's for gene transfection or to get drugs into the brain. It really just depends on your specific application. There is a sonoporation probe which can be integrated into the system, and the software allows you to fully control how that sonoporation probe is performing. And so this is just simply an example of the contrast signal over time in a specific region of interest. And we can see these dips, and this is going to be the area where the sonoporation probe was pulsed to cause cavitation of the microbubbles and therefore destroy the microbubbles and decrease that signal intensity from them. Okay, so now I'm going to turn it back over to Martin for a second poll of the audience.
Thank you very much, Tanya. And I think that was a great start to the webinar. I'm hoping everyone is enjoying the presentation so far. We actually have had quite a few questions come in already, which is great. And please do continue to send them along. We'll get them answered after our presentation. Okay, so poll number 2, this will be quick. We would like to know, just based on the add-ons that Tanya mentioned moments ago, are you interested in learning more about any of the specific add-ons or imaging modes discussed? And if you could just select any or all of the following. So if you'd like to learn more about 3D imaging, select the first option, image-guided injections, shear wave elastography, sonoporation, or even just the basic imaging capabilities of the system. So with that said, Tanya, I'll let you kind of monitor the poll's progress and then you can continue when ready.
Wonderful, thanks Martin, and thanks everyone for taking the time. I'm going to give everyone a couple more seconds just to finish off their entries. And I'll go ahead and end the poll. And so from now on, I'd actually like to focus on specific research applications. And so we'll start to take a look at cardiovascular research, which it looked like from the first poll, there's a number of people attending for that, as well as cancer biology. We'll spend a little bit of time on some abdominal and anatomical imaging, developmental biology, and just really briefly touch on ophthalmology and any other animal models that we can image using the system or have examples of imaging. And although I'll present specific images from the zebrafish and the chick embryo, the system really can be used across many different animal models. And so just reach out to us and ask if we have examples or what our thoughts are on being able to use the system for that specific animal model. Moving now to cardiovascular research. As I talked about before, this is a B-mode image, and we can see the heart, specifically the left ventricle, beating in time. And so again, this is the parasternal long axis view, in which we can see the apex of the heart and the outflow through the aorta. We can actually see the mitral valve and the left atrium here as well. And so from the long axis view, if we then rotate the probe 90 degrees, we're going to begin to see the left ventricle beat as a circle. And so here we're going to be able to see the right ventricle off on this side, as well as what we're using as an anatomical landmark to know that we're always going to be taking this image in the same plane is the papillary muscles, these little balls that you're seeing here. And those actually connect up to the mitral valve and allow us, again, like an anatomical landmark for us to know that we're getting our images from the exact same place every single time. And so again, the papillary muscles and a nice round structure are used for the short axis view. And for the long axis view, we do want to see the apex and the aortic outflow to know that we're in the same place each time as we go through our longitudinal study. From the B-mode image, we can do measurements on cardiac function, specifically for systolic function. And there's a number of different measurement tools within the analysis package. I've just focused on one here. And basically with this one, you're going to outline the endocardium, or the inside of the myocardium, and the outside, or the epicardium, through systole and diastole. And then you're going to make a length measurement of the ventricle, again in systole and diastole, going from the apex to the aortic valve. And from that, the system's then going to calculate many different measurements of systolic function, as well as the LV mass measurements. So we can get diastolic volume, so we can look at dilation of the ventricle and heart failure, for example, measurements of stroke volume, ejection fraction, fractional area change, fractional shortening. These are the ones typically published. And then measurements of LV mass and the mass index. We talked about earlier M mode. So again, here we're looking at the motion of the heart across a specific point in time. And again, we're seeing the heart as it moves through diastole into systole, diastole, and systole. And this mode is often used to make measurements of systolic function in many of the publications that are out there. And from here, what we're going to do is make linear measurements. And we can make multiple copies of this throughout the entire heart, and then the system will simply take an average and give us the systolic functional measurements. And so here again, we're going to measure the thickness of the wall, the ventricle diameter, and the thickness of the posterior wall, both through diastole into systole, and measure the heart rate as well. And in doing so, we're going to get very similar measurements that we got from the B-mode image, but again, these are from M-mode, which can be done on both short and long axis images. And this is typically what people are publishing in their data, depending again on the model that they're working with. Moving now to Doppler, we can start to take a look at cardiac output. And so this is where we're looking at how is the heart functioning in systole. And that's a matter of combining stroke volume along with the diameter of the vessel. And so we need both pulse wave Doppler, here where we're seeing the flow through the ascending aorta, where we get the velocity time interval. We're measuring the diameter of the vessel using a B-mode image, and the software and measurement package is then able to calculate the cardiac output for us, as well as some other measurements from the Doppler, pulse wave Doppler signal, or the velocity time interval. So that's looking at systolic function. Moving to diastolic function, we're typically looking at flow through the mitral valve. And so that's flow from the left atrium, as we see here, into the left ventricle. And again, we're using color Doppler to identify the jet flow velocity, and then we're using pulsed wave Doppler to measure that. And so here we're going to see our E and our A peaks, which are very traditional for this. E simply being the early filling, where the ventricle is actually passively relaxing and pulling blood in from the atrium. The A peak that you see here is simply the contraction of the left atrium to push the remaining blood through. As a heart stiffens or there's changes in how it's functioning in diastole, this E wave won't be as effective, or the E portion of the diastolic function won't be as high, and that's because the ventricle is no longer able to relax quite as well as it used to, and so the atrium is going to have to work very hard to push the remaining blood through, and we're going to see a rise in this A peak. And so it's typically this E to A ratio and different timing intervals that we measure here, which tell us a lot about diastolic function. The exact opposite happens in the right ventricle, as we see here in the tricuspid valve. Here, normally, the E peak is lower than the A peak. Again, they refer to the same time frame when the right ventricle is beginning to relax, that's your E peak, and when the right atrium contracts, that's your A peak. And again, it is traditional for the E to be lower than the A for the tricuspid valve. And again, changes in these ratios are going to start to tell us a lot about what's going on within the different ventricles during diastole. There's a full measurement package here, again, where we can identify the peak of the E, the peak of the A, different time intervals to get us measurements of the TI index, for example, the isovolumic relaxation and contraction times, as well as that E to A ratio, which are the typical things which are published these days regarding diastolic function. The system is also capable of doing tissue Doppler, and this is very similar to pulse wave Doppler, except this time we're looking for movement of tissue. And so here specifically we're looking at tissue moving at the mitral annulus, and this can often be an earlier indication of something changing before blood flow changes happen. And again, we're seeing almost a complete inverse of what's going on in that pulse wave Doppler, where we have the E and we have an A peak. And here it's just called E prime and A prime, and that's coming from tissue Doppler. And the ratio between E prime and E from the pulse wave Doppler can tell us a lot about what's going on here as well. So this is done by some people doing cardiovascular research, but not everyone, but it is available on the system. Looking now at the aortic arch, so we're moving outside of the heart, we can begin to see the aortic arch as it beats through time. And so here again, we're seeing the ascending aorta as it comes up and wraps around, the innominate artery, left common carotid, and left subclavian. You can imagine that if you had a TAC model or transverse aortic constriction model, you'd be able to actually visualize the suture between the innominate and the left common carotid artery. Because the suture is quite dense, it's going to reflect the sound very strongly. And so we'd be able to visualize that suture. We'd also be able to use color Doppler to visualize changes in flow velocity. So if we cause the stenosis with the TAC model, we're going to see an acceleration of the blood flow through that narrowing of the artery, and we could visualize that and measure it using color Doppler and then subsequently with pulse wave Doppler as well. Moving further out in the vasculature, here again we're looking at the carotid artery, this time of a rat. So again, we can see the common carotid as it comes up and bifurcates to the external and internal carotid artery. As we zoom in on this image, again, remember that the scale on the right-hand side is in millimeters. We can make linear measurements to look at the intima media thickness of these vessels and measure changes or detect plaques if you had an atherosclerotic model, any number of diseases here. Again, we can use color Doppler and pulse wave Doppler when looking at flow through these vessels. We do need to keep in mind here the angle that we're able to achieve is relatively large between the sound coming in and the angle of the blood flow velocity, but we do get waveforms very indicative of the carotid arteries, as you can see here. Likewise, within the kidney and the renal structures, we can begin to see flow within those. As with all peripheral vessels, we can make measurements that take a look at the systolic to diastolic flow velocity ratios, measuring peak velocity and diastolic velocity. And these can all be used to calculate the resistive and pulsatility indices for these vessels. And so again, this is not specific for the renal, it's across all the peripheral vessels. This measurement package could be used. Finishing up with cardiovascular research, we of course can do the image-guided injections as we talked about earlier. So again, the mount can be used with really any needle and syringe that you'd like. So here we have a traditional syringe with a steel needle, and you're basically going to image your anatomical target, here being the myocardium, advancing the needle here with the knob, and you're able to visualize that on the screen and ensure that you're injecting into the proper place. If you wanted to know exactly where you injected, you could mix a little bit of contrast agent into whatever you're injecting, and you'd be able to visualize that very clearly on the screen and see exactly where you injected the material that you're delivering. For example, injecting stem cells into the border zone of an infarct to hopefully speed healing, as an example. So moving now to cancer biology, different applications. So again, with B-mode imaging, the first thing that we want to start to do is identify and detect tumors very early on. And so these are examples of very small lesions that are being formed within the liver, and we're able to identify those from the normal parenchyma. We of course want to look at the surrounding structures to see if they're being affected. So this is actually an axillary lymph node that looks quite normal. Once they start to get enlarged, this fluid, which appears dark on ultrasound, is going to become, this area is going to become quite large, and we can begin to see internal structures as cells begin to build up within the lymph nodes, and just a lot of different anatomical changes happen. The structure that you're seeing here off to the left-hand side is actually the muscle on the hind limb, and the white area that you're seeing here is fat surrounding. Again, this looks normal, but you'd be able to monitor that and see if there was any changes as the disease began to progress. We of course want to make measurements, and so here on a B-mode image we can do either linear measurements or area measurements. And this is simply within a two-dimensional image. But as I mentioned earlier, we have that 3D motor which can be added onto the scanning platform. And again, what that's going to do is translate the animal underneath the probe and take multiple two-dimensional B-mode images and restack them together to create your 3D volume or your 3D image. You can then use a software analysis package to be able to create your 3D volume. Here, the orthotopic breast tumor measured 211 millimeters cubed. And so you could use and monitor that same animal over time to look at changes in tumor volume as the disease progresses, or regression of disease if you're giving a therapeutic intervention. Often within cancer biology, we want to start to look at tumor perfusion. And so we talked about contrast agents earlier on, and that we inject them, they stay within the vasculature. These are non-targeted contrast agents, and we're able to visualize them. We reviewed the two different ways to do that: reference subtracted, which you're seeing here, and harmonic imaging. But of course, what we want to do further from visualizing is be able to quantify. And so within the software, you can draw different regions of interest around your tumor or around the entire tumor and begin to quantify that change in perfusion or differences within the different regions. So here we can see that this was before the contrast agent was injected. And then here we're seeing the contrast agent enter the tumor. And we can see that the red region of interest, the contrast agent enters well before the blue or the yellow. And so that can tell us a lot about perfusion within the tumor, necrotic cores, changes that are going on. And if we do this longitudinally, then you can start to take a look at changes over time or response to a therapeutic intervention, for example. Moving on to abdominal and anatomical imaging, we can identify all of the different abdominal organs. So here we're looking at the liver, the vessels running through the liver parenchyma. The gallbladder in mice, for example, is going to be filled with bile, and so we're able to see that as a very dark structure because it doesn't reflect sound. If there were stones within the gallbladder or debris within the gallbladder, we would begin to see that on a cine loop image as well. The spleen has a very characteristic appearance, and the pancreas can also be identified, and this is typically done by identifying the organs surrounding it, identifying the splenic vein, which does run through the pancreas, and then knowing that we're looking at that region of the pancreas there, with the kidney here on the left. The kidney, of course, can be imaged, and the medulla and the cortex look quite different. And as I mentioned earlier, we can start to look at the vasculature either within the kidney or the renal artery going into the kidney as well, using that peripheral vessel analysis package to look at the pulsatility and resistive indices if we'd like. Of course, the abdominal aorta can be imaged. This one's quite normal, so we're seeing very straight lines up the wall. If you had an abdominal aneurysm, you would be able to visualize that very clearly and see how big it had gotten and make those measurements. As well, you can use color Doppler and pulse wave Doppler on the abdominal aorta to be able to look at flow velocity changes as well. Here we're looking at musculoskeletal areas, so the femur, the tibia, the synovial membrane in between them around the knee, muscles. So if you're doing a high limb ischemia model, you can begin to look at the different muscles using contrast agents again to look at differences in perfusion if you'd like as well. Urogenital imaging, so here we see a mouse ovary. So again, your scale on the right is in millimeters, so this is a very small structure. Cysts are going to again be fluid filled, so they'll look very dark on the image, so we can begin to identify cystic areas forming on the ovaries, for example. We can also look at the prostate, the bladder, all those other different structures that may be of interest as well. Looking now at developmental biology, we'll just spend a couple slides here on this. We can visualize a uterine horn when the animal's not pregnant. So of course we can confirm pregnancy very early on by being able to see these bulges as the embryos begin to develop. And then we can monitor their development over time. So here at 7.5 days, we're not really seeing any identifiable embryo here, but we know the animal's pregnant. By 9.5 days, we can begin to see the early formations of the embryo and the neural tube being formed in the embryonic heart. We can see the ventricles within the brain of the developing embryo, the spinal cord as it develops and progresses, and even see the front paw of an embryo at E14.5. This is here in a mouse. All of the imaging modes that are available for adult animals are also possible to be used on the embryo, because at this point they don't have calcified bone formed. So we're able to see the heart really well, all the structures within the brain. And so here we're actually looking at flow through the mitral valve in the developing embryo, flow in the umbilical cord and umbilical vein, dorsal aorta as long as they've developed far enough along for that vessel to be large enough for us to visualize it. And M mode even so much as to look at the heart. And so from here you could actually calculate the heart rate of the developing embryo, because if we're monitoring the dame as she's being imaged, the ECG signal that we're getting on the system is actually going to be from the dame and not from the embryo. But here you'd actually be able to look at the heart rate of the developing embryo as well. Image-guided injections. So here, this is a survival surgery. An abdominal incision is made, and each of the embryos is actually popped up through this petri dish, and a pulled glass capillary needle can be used to do the injections into the embryos. So here we're seeing an injection into the ventricle of the brain of a target of interest, for example. Once completed, the uterine horn is then put back into the dame. She's sewed up and the embryos are allowed to continue to develop and be delivered naturally. Taking a quick look at ophthalmology. So this is looking at the different structures in the eye. So this is a mouse eye, and we're able to take a look at all the different anterior structures. We can again use Doppler to look at flow through the retinal artery, as well as color Doppler to visualize the retinal artery. We can use the 3D imaging as we did on tumors to look at structures, not just for tumors, but abdominal organs as well as the eye. And here we're looking at the rabbit eye and looking at thickening of the cornea as an example. So looking at the normal animal, and then when treated, which has a thickening of the cornea, different structures such as the iris and the lens surface, the ciliary process, all these different things can be imaged using the system if that's of interest to you in the work that you're doing. Finally, I'll finish up with other animal models and show you a couple of different examples. So zebrafish can be held within either a foam or a plasticine holder, and we're able to image through the belly of the animal or the dorsal area of the animal quite well, because that's a nice soft area. And we're actually able to measure flow through the heart. So some groups doing resection of part of the ventricle can begin to look at returning flow and function of the heart, both in B mode, color Doppler, as well as using pulse wave velocity to measure and quantify that. Looking at chick embryos, so here we're actually able to see the developing heart. In this case, the shell is just shaved off at the area of the air pocket, and this is where the embryo is developing on the membrane, as you see here, and we're able to actually see the heart as it's developing, again using B mode to look at it and Doppler modes to be able to quantify the flow changes as that embryo develops. I'd like to just finish off with our last poll, so I'll bring Martin back on.
All right, thank you very much, Tanya. And yes, this is our last poll, and we have about 10 minutes left in our talk. So there are two questions here. They're short and sweet. The first question is, what specific animal models are you working with? And if you could just select from the list that's presented there, mouse, rat, larger rodent, zebrafish, chick embryo, or something other, again, specify in the chat window if that applies to you. And then we'd like to know if you might be interested in seeing the system live in your own lab. If you are, please select the first option. If you'd like to discuss further, select the second. And if you're not interested, then select the third. So we'll just give you a moment to finish this poll. And a reminder to everyone, we will begin our question and answer session momentarily. So please do submit as many questions as you like, and then we'll get started. Tanya, back over to you.
Great, thanks, Martin. I'm just going to give everyone a couple more seconds to answer the poll question. I'm also going to use this time to look a little bit at the questions that have come through. So again, just a couple more seconds. Perfect. So I'm going to end the poll now, and I'm going to just summarize what we talked about today. So we started talking about initially the basics of ultrasound imaging with a brief overview of the different imaging modes, hoping to get everyone up to speed so I can use the common terminology that sonographers do for B mode and M mode and things like that. And so you have a basic understanding of why high frequency imaging is important in the small animal world. A quick overview of the system itself, and then focusing a lot of the time on the different key research applications like cancer and cardio applications. So I hope that you were able to get something from this presentation, either learning more about ultrasound imaging or how imaging can be used in these different application areas. And so right now, I'd like to bring Martin back on board, and we can start by answering some of the questions that came through before the webinar started today. We can address those, and like Martin mentioned, any of those which we're not able to address during the question and answer today simply because of time. We will prepare a transcript and send that out to everyone that should have all the answers that you're looking for. If you come up with other questions as you think about how you could use this in your lab, feel free, of course, to reach out to us, and I'd be happy to address any questions that you come up with.
Okay, thanks, Tanya. So we have about 5 or 6 minutes, and as you mentioned, we did receive some questions prior to the session. Most of them are sort of technical in nature, but we'll start there. And that will also give us just an opportunity to sift through some of the other questions that have come in. So first question is, can a keyboard and mouse be attached to the tablet of the Prospect T1 system to make data input and measurements on the system just a bit easier?
For sure, that's a really great question. So as I mentioned during the presentation, it is a 15-inch touchscreen display that does work with gloves, but obviously for entering labels onto images and making measurements, a keyboard and a mouse would make that significantly easier, and that of course can be added onto the tablet system itself if you'd like for use during your acquisition. And of course there's always the offline analysis package which can be used to do analysis offline on your own computer, which would of course have those peripherals attached.
Okay, perfect. You also mentioned different data formats during your presentation briefly, but can you just elaborate on what data formats can be exported from the system?
Sure. So for those who are more advanced in terms of the physics use, and I see a question around detecting fatty liver disease from Michelle Hempkins. And so typically at that point, you're looking at very detailed information about the exact frequencies of sound that are coming back and the brightness and the intensities. And so it may be that you need to look deeper into the data, and so the system comes with the raw data export capabilities for you to be able to do that, which would probably be the most appropriate way for you to look specifically for fatty liver disease, because that signal is going to come back much brighter, as fat does reflect the sound much more strongly than the liver parenchyma. Cine loop images can be saved, and this is a nice recording of multiple frames as you take your images of interest. These can be used later on to do further measurements and of course export specific still images or movies as you'd like. The still images can be exported as bitmaps, JPEGs, TIFFs, and PNGs. Videos come out as AVI files, and of course there's DICOM compatible versions for data export as well if you prefer to use a DICOM viewer to either store or visualize your data. I think the next question that we had that came through was about ECG and respiratory gating and if that was possible. And so on the animal handling platform that you saw both for mice and for rats, there's 4 electrodes, and those allow us to measure both the ECG as well as the respiratory signal. And both of those signals sorry, can be used to do gating on either, again, the respiratory or the ECG signal.
Perfect. Okay, and the next question that came in is what is the maximum range and minimum step size of the 3D motor that you introduced to us?
For sure. So as we saw, that motor mounts to the side of the animal handling platform. The maximum range of that motor is 30 millimeters or 3 centimeters, and you can select how far you want that stage to move based on the target that you're looking at. The minimum step size is 0.05 millimeters, so quite small. And again, you can increase that if you want the acquisition to be faster and you don't want the out-of-plane resolution to, you're not as concerned about the out-of-plane resolution. But again, that's going to take multiple B-mode images in 2 dimensions and stack them back together. I like to think of it as like my loaf of bread. So I've got my different slices, and when I stack them all back together, it looks like the entire loaf, which I can then reslice in any orientation that I want as I view that image within the visualization software.
Great. Okay. What's the maximum frame rate in B mode?
Yep, so this often will come up with cardiac researchers, and I was surprised it wasn't one of the first questions that I scrolled through. The frame rate with a single element transducer is 30 frames per second for normal B mode imaging. The system does have a specific cardiac reconstruction mode, which is possible, and that's basically where the system is going to open it up, take as many B mode images as it can, 2-dimensional B mode images as it can, acquired with that ECG signal, and it can then reconstruct those images back into a cine loop of the entire cardiac cycle, and that would be at 190 frames per second. So that's going to give you a very nice frame rate for looking at cardiac function. But again, most people are making their measurements for cardiac function on M mode images, and that frame rate is, or sampling rate, because we're looking at a single line, is 3,500 scan lines per second. So that's a much higher frame rate or sampling rate if you'd like to do the measurements on the M mode image.
Okay. I'm just keeping an eye on the time. We have a couple of minutes left, and we have lots and lots of questions come in. I don't know, Tanya, do you want to give a quick scan through? And
yeah, I've picked out one from Dr. Kelly, and her question is a fusion of the E and A waves related to resolution of the probe or heart rate of the animal, specifically a rat in her example? And so if you remember when we were looking at the mitral valve flow, I was talking about the E peak and the A peak. And again, the E peak is when the ventricle dilates and pulls the blood in from the atria, and the A peak is when the atria contracts to push the rest of the blood through. And so if we think about heart rate on a rat might be anywhere from 200 to 300, maybe a little bit higher. On a mouse, it's going to be significantly higher. So the resolution of these 2 peaks has a lot more to do with the heart rate of the animal than it does the resolution of the probe. And so when the heart rate goes above 500 beats per minute, or 550 beats per minute on a mouse, those 2 things are happening almost simultaneously. And so being able to resolve the E and the A peak becomes exceptionally difficult. And there's not a lot that can be done in terms of the heart rate, because you do want to make sure that the heart is functioning as close to physiological as possible. But again, it doesn't have to do with the resolution of the probe.
great. Okay, and do we have time for one more? What do you think?
I think we do. I'm just scanning through to pick one out. So there was one question of a lot of animals you spoke about are quite small. Can this be used in larger animals such as goat, bovine, etc.? And so the answer comes down to depth of penetration. And so if the structures that you're looking at are quite superficial, so we're looking at 2.5, 3 centimeters at the very deepest for the 20 megahertz probe. Then we can visualize those structures, or we can try to visualize those structures. Again, it depends on what's in the way. If the skin is very tough and dense, then it's going to block most of the sound and again affect the penetration. So again, it just depends on the anatomical structure that you're looking at, the depth of it, and what you need to see.
Okay, perfect. And I think those are good questions that we can answer sort of offline if anyone wants some more information. So with that in mind, I think we have reached the 60-minute mark, and to be respectful of everyone's time, let's wrap things up. And as we did mention at the beginning of the webinar, we have recorded the session, and we are planning to answer all of the outstanding questions. So we'll be in touch with you personally, and then within the next, I'd say 24 to 48 hours, just look out for an email from us. It will have a link to the recording, a link to the slide deck that Tanya presented today, and also a transcript of all the questions that were asked and our responses to those questions. So with that said, Tanya, I'd like to thank you for the presentation today. It was really fantastic. I think you have a gift for taking complex concepts and simplifying them. Even I learned a great deal today, so thank you. And I trust we've been helpful in providing a high-level overview of ultrasound imaging and how it can be applied to your research. And I would encourage you to please reach out to us with additional questions. So thanks again for taking time out of your schedule to be with us today, and we look forward to seeing you again at a future Scintica Instrumentation event.
Thanks, Martin, and thanks everyone for taking the time. Again, if you are at EB or AACR, just look out for us there, and if you'd like to see more about the system or discuss your research further, I'm happy to do so when we're there. Thanks again.